The thing that first alerted me to having an issue was one fine spring morning. I was out, I needed to go for a pee, and my pee was red, bright blood red. So I knew there was something seriously amiss. On reflection, some weeks or months before that, there had been a bit of discomfort in the bladder at various times. I'd been getting up a little bit in the night and early in the morning, which was a little unusual for me. But I was mildly worried about it, but it was something that probably didn't feel quite serious enough to go to the doctor with.
When I had blood in my urine, it was what prevented me from asking for help initially was that it was just on occasion. So there'd be a tiny bit of blood, and then I think, oh, maybe I've caught myself, or, maybe I've done something. And it was, I don't know if it was 2 to 3 months, but it was when it became more. And then it was actually the whole toilet pan had blood in it. And at that point, I said to my husband, I think I might have a problem.
I went out for a few drinks, came home, and there was blood in the urine. And I went to a clinic, and they said, you've got to see your GP. They tested me, and I only ever had blood in the urine once more, which was about a day after that, and then it never occurred again. So it would have been quite easy for me, maybe if I hadn't been as aware of those symptoms, to just written that off.
Before my diagnosis, I did have bladder infections, yes. Urine infections. I did, yes.
Looking back, I probably had a few aches and pains lower down, but I wasn't, well, because I didn't know what the blood was about, I wasn't connecting the blood, and I didn't have pain if I had, say, aches more in the pelvic area, but I didn't know they might be associated.
I was perhaps unusually young to have bladder cancer. I was aware of it. My father had bladder cancer, a mild form of bladder cancer, and his father before him died from bladder cancer, sadly, when he was only in his 50s.
It was the shock of my life. There was a lot of blood in my urine. And that was a bit of a shock. So I actually immediately went to the doctors, probably within 24 hours.
When you have a diagnosis of bladder cancer, you don't feel very normal, but there's lots of normal stuff going on. And just appreciating that is one thing that I think helps you to get through.
I feel I've always known my body, but I think anybody, if they have a feeling there's something wrong, then look into it. That's my big positive, because if I hadn't have followed it up, it would have spread.
When I did see the GP after passing blood, she reacted very quickly, as I think, it's important for people to realise that, blood in the urine is a red flag symptom. If you go to your doctor with blood in your urine, they will react very swiftly and very decisively.